السلام عليكم ورحمة الله وبركاته. مرحبا بكم أعزائي متابعي قناتي على التليجرام في محاضرة جديدة من محاضرات الجنرال باثولوجي، وبالتحديد في جزئية الالتهاب. طبعا أعطينا الجزء الأول the etiology and the molecular aspect of the inflammation, including the cellular responses as well as the vascular responses. On the second lecture أخذنا morphological patterns of inflammation. Today it will be the last lecture in the inflammation, which is the chronic inflammation and tissue repair. So chronic inflammation هو الالتهاب المزمن، لكن قبل ما نعطي chronic inflammation في جدول حبيت نعطيه الكم توا، وهو تتمة chemical mediator of acute inflammation. Say for example histamine, it's released by the mast cell and basophil leukocyte and it promotes vasodilatation. The second chemical mediator is serotonin, which is 5-hydroxytryptamine, released by the platelets and enterochromaffin argentaffin cells in the GIT, producing also vasodilation or vasodilatation. Bradykinin, produced by the mast cells, and it increases the vascular permeability and promoting smooth muscle contraction with creation or sensation of the pain. Prostaglandins, it's produced by the eicosanoid, which is the arachidonic acid pathway, and promote fever, pain, and clotting. Leukotrienes, it's also a product of the cell membrane of the eicosanoid, which belong to the arachidonic acid pathway, increasing vascular permeability, producing chemotaxis, and promoting vasoconstriction. Lipoxin, it's also a product of eicosanoid from the cell membrane by the arachidonic acid COX and LOX pathway, producing vasodilatation and compromising or decreasing the vascular permeability. فتلاحظوا بأن اللايبوكسين عكس الليكوترينز. الليكوترينز increase vascular permeability, producing vasoconstriction, while lipoxin producing reduction in the vascular permeability and vasodilatation. Nitric acid, it's the main vasodilator of the human being, and it's produced by the enzyme eNOS, which is the endothelial nitric oxide synthase. Platelet activating factor PAF, it's produced by the eicosanoid, which is arachidonic acid pathway, and it's a product of the cell membrane, which means PAF, platelet activating factor, is a powerful activator for the platelets. Platelets are the granular thrombocyte. Tumor necrosis factor alpha and interleukin 1, it's produced by the macrophage, producing a cytokines, which is a cytokines that promote or upregulate P and E selectin over the surface of the endothelial cells. So these are the chemical mediators of acute inflammation. So what is exactly chronic inflammation? Chronic inflammation يعني الالتهاب المزمن هو the inflammation that has a prolongation of the duration, which might be weeks or years, and usually it's characterized by continuing inflammation. Continuing inflammation is typically producing more tissue injury, and the healing is typically occurred by fibrosis. What is the main inflammatory cells of chronic inflammation? نحن قلنا acute inflammation is produced by polymorphonuclear leukocyte اللي هي النيوتروفيل, while the inflammatory cells of chronic inflammation is mononuclear cells including macrophage, lymphocyte, plasma cells. وتلاحظوا بأن tissue destruction in general في chronic inflammation is more obvious or more prominent. Repair in chronic inflammation is typically occurred by producing a new vessels formation, which is the angiogenesis and fibrosis. So the process of angiogenesis and fibrosis are the feature of chronic inflammation. So what is the cellular players of the chronic inflammation? Mainly lymphocytes and macrophage, which is the histiocyte. To lesser extent plasma cells, and to much lesser extent eosinophil and mast cells. So these 5 cells, lymphocyte, macrophage, plasma cells, eosinophil, and mast cells are the main cellular players of the chronic inflammation. What is the etiology of chronic inflammation؟ يعني ليش الانفلاميشن يتحول من بدل التهاب حاد إلى التهاب مزمن؟ mainly إن infectious agent الشراسة متاعته أقل ويشتغل بهدوء. there is a persistent chronic infection, for instance Mycobacterium tuberculosis TB, which is the السل الرئوي, or the one that produce syphilis Treponema pallidum. Treponema pallidum اللي هو مرض الزهري أو syphilis. These are persistent and chronic infection. If there is an autoimmunity means hypersensitivity reaction in which the body attack itself. يعني جسم يحارب في نفسه زي autoimmune disorders, for instance type 1 diabetes mellitus, psoriasis, rheumatoid arthritis, inflammatory bowel disease IBS, التهاب الأمعاء الالتهاب المزمن IBS, or rheumatoid arthritis التهاب الروماتويد المفصلي, وسورايسيس خذيناها من قبل تذكروا في الجنرال اللي هو الصدفية. Or the second reason, السبب الثالث للetiology of chronic inflammation is there is a prolongation of the exposure of the toxic agent زي الجماعة اللي دخنوا cigarette smoking, or the silica which is the silicosis. These three reasons of the etiology are the one which are responsible for the chronic inflammation. First, persistent chronic infection like TB and syphilis promoted by Mycobacterium tuberculosis and Treponema pallidum respectively. Hypersensitivity producing an autoimmunity or autoimmune disorders, for example psoriasis, rheumatoid arthritis, inflammatory bowel disease. Prolongation or the exposure of the toxic agent, for instance cigarette smoking or silica. المين بلاير خذيناه هنا قلنا هو الليمفوسايت والماكروفاج. خلينا ناخذ هنا سلوك تدير فيه الماكروفاج. الماكروفاج تدير فيه سلوك غريب جدا ألا وهو إنها تشتغل ب2 pathway. The 2 pathway produce some sort of inflammatory switch which lead to 2 mode of activation of the macrophage. One is called M1 and the second is called M0. Let's start by taking the modes طرق أو أنماط activation of the macrophage. So the classic activation of the macrophage, which is called M1, is that the macrophage is getting activated by interferon gamma and inhibited by interleukin 13 or 14 to produce reactive oxygen species nitric oxide and lysosomal oxide, lysosomal enzymes. تلاحظوا هذني they produce a microbial action by either phagocytosis or killing of the bacteria by ROS, reactive oxygen species, or by the proteolysis of the microorganism by the lysosomal enzymes. The classic activation of the macrophage also produce let the macrophage يخلي الماكروفاج تطلع interleukin 1, interleukin 12 and interleukin 23. These are and the chemokines. These are a producer of inflammation. Then the classic activation of the macrophage produce the substance that destroy or phagocytose the microorganism like reactive oxygen species, nitric oxide or lysosomal enzymes, and also cytokines that promote inflammation like interleukin 1, interleukin 12, interleukin 23, and chemokines, which produce inflammation. This process is mainly promoted, يعني activation of the macrophage by the M1 pathway will be activated by interferon gamma promoted by the microorganism, and it's getting inhibited by interleukin 13 and 4. So if there is interleukin 13 and 4, there will be an inhibition of the classic macrophage and activation, which is called M1, into the M2, which is the alternative macrophage activation اللي هو مسؤول عن anti-inflammatory switch and the fibrogenesis. So let's see here what is the second pathway. It's called alternative macrophage activation M2, which lets the macrophage, طبعا it's promoted by interleukin 13 and 4, and it's getting inhibited by interferon gamma, IFN gamma, which is enhanced by the microorganism itself. The activation of the macrophage by the alternative pathway M2 will let the macrophage produce interleukin 10, which is a potent anti-inflammatory agent, and TGF-beta, tumor transformed growth factor beta. These having anti-inflammatory effect. The growth factor inhibitor TGF-beta, transforming growth factor beta, is the one which is responsible for the fibrosis and promoting tissue repair. That is the fibrosis. So these are the two pathways of the monocyte or macrophage activation, producing a pro-inflammatory effect by M1, which is this one. This is called M1, producing interleukin 1, 12, 23, and chemokines and reactive oxygen species nitric oxide and lysosomal enzyme. This is a pro-inflammatory response, while the M2 responsible for the anti-inflammatory effect and tissue repair and fibrogenesis, promoted mainly by interleukin 10 and TGF-beta, tumor transforming growth factor beta. So you can see here the macrophage عندها سلوكيات مختلفة تماما. مرة تشتغل pro-inflammatory ومرة تشتغل anti-inflammatory. وهذا التوضيح إن الماكروفاج by the IFN gamma and lipopolysaccharide of the gram-negative bacteria and tumor necrosis factor alpha will produce M1 activation, and by interleukin 4, 13, and 10 and TGF-beta produce the alternative macrophage activation M2. The classic M1 promote T helper cell response, antigen presentation, and produce reactive oxygen species 12 and 23 وانترلوكين 1 و6 وتيومر نكروس فاكتور وكيموكاينز. لاحظوا ان الريسبونس هذا كان pro-inflammatory ولا anti-inflammatory؟ pro-inflammatory. That's why it produces cytotoxicity and tissue injury. While the second pathway is the alternative pathway promoted by the inflammatory cytokines interleukin 4, 13, 10, and TGF-beta, transformed growth factor beta, producing macrophage alternative activation M2, which promote the T helper 2 response with production of interleukin 4, 10, TGF-beta. تلاحظوا بأن الانترلوكين 4 والانترلوكين 10 و TGF-beta are anti-inflammatory and mainly angiogenesis. The angiogenic factor like PDGF, VGF, EGF, and arginase. This will produce immune suppression, tissue repair, and mainly anti-inflammatory response and fibrogenesis. فسبحان الله تلاحظوا بأن two pathway of macrophage activation هم ظلموها من قبل الدكاترة في الطب، سموها البالعات. بالله عليك يعني خلية فخمة زي هذه عندها different mode of activation تفرغ بأنها تسمى بالعة؟ أبدا. وجد بأنها عندها two responses. One is the M1 classic activation to produce a pro-inflammatory cytokines and cytotoxic injury to the cells, while the second M2 alternative pathway promoted by the anti-inflammatory cytokines interleukin 4, 13, 10, and TGF-beta, promoting an anti-inflammatory effect, angiogenesis, and immunosuppression and tissue repair. So يعني الموضوع وضح توا وقلّأ الموضوع إن الetiology of the chronic inflammation is usually by the activation of T lymphocyte which produce the growth factor and the chemokines. The chronic tissue injury and infection produce bacterial and tissue-derived monocyte chemotactic factor and tissue-derived mitogens. This eventually will lead to proliferation of the macrophage and recruitment of the monocyte. طبعا تلاحظوا بأن recruitment of the monocyte by the bacterial and tissue product monocyte chemotactic factors, while the tissue-derived mitogens will produce a local enhancement or proliferation to the tissue macrophage. Then the macrophage number will increase and lead to a long-lived tissue macrophage and it's getting flat, more flat زي ما حكينا من قبل, to get transformed to the epithelioid cells and sometimes lead to the joining of the nuclei leading to the formation of the multinucleated giant cells. chronic inflammation لو نسيته قول macrophage. So the chronic inflammation والماكروفاج وجهان لعملة واحدة, وهو الاتيولوجي الحقيقي للchronic inflammation. فتلاحظوا بأن هنا بعد ما يصير activation للM1 leading to cytotoxic tissue injury, العكس هو الM2 activation which lead to angiogenesis, immune suppression, tissue repair and fibrogenesis. زي ما قلنا chronic inflammation and infection usually produce a bacterial and tissue-derived chemotactic factors and tissue-derived mitogen with activation of the T lymphocyte which produce growth factors and chemotactic factor. كل العوامل هذني يسبن recruitment of the circulatory monocyte اللي في البلد عشان يطلع في التشيو يتحولا إلى tissue macrophage or histiocyte. Proliferation of the tissue macrophage will lead to increased number of the macrophage with subsequent formation of long-lived tissue macrophage that might transform to epithelioid cells with the flat macrophage or joining together the nuclei to form a common committee giant cell granuloma cells, which is called in case of infection it's called Langhans. تذكروها؟ المحصلة النهائية هو وجود ايش او creation انه يحدث chronic inflammation. So the chronic inflammatory cells and mediators are mainly lymphocyte and macrophage. So the lymphocyte are T lymphocyte and B lymphocyte. The T lymphocyte secrete cytokines and recruit other type of the inflammatory cells, while B lymphocyte it's getting transformed تتحول ال B lymphocyte مع الانتيجين activation إلى the plasma cells which produce the immunoglobulin IgM IgG. The other cells of chronic inflammation are eosinophil and mast cells. These are mainly produced in response to the sensitivity في حالة الحساسية اللي هي تسبب allergy. For example, some allergic disease like asthma or parasitic infestation with upregulation or more formation of the immunoglobulin IgE. So لو سألوكم قال لكم what are the main cells of chronic inflammation قلنا macrophage وmonocyte وlymphocyte. Lymphocyte two types, T lymphocytes which secretes chemokine and cytokines which recruit the inflammatory cells, other inflammatory cells, while B lymphocyte في الحقيقة إنها activated lymphocyte by the antigen transformed to the plasma cells which produce immunoglobulin IgG and IgM. انتوا عارفين IgG is the primary IgM is the primary و IgG are the secondary immunoglobulin اللي هو الأجسام المضادة. Other cells which might get involved are eosinophil and mast cells which is getting prominent or regulated by the allergic disease, for example asthma, and some parasitic infestation which is mediated mainly by immunoglobulin IgE. على هذا الأساس أول ما درسوا الماكروفاج من زمان زي ما قلت لكم تفهوا الماكروفاج وسموها الخلايا البارعة. لا، استيحاء من قصة الأديب العظيم روبرت لويس ستيفنسون سنة 1886 by a Gothic novella, the Scottish author Robert Stevenson, The Strange Case of the Dr. Jekyll and Mr. Hyde. القصة الغريبة للدكتور جيكل والمستر هايد اللي هو تحكي على دكتور في الفترة الصباحية يقعد دكتور ويعالج المرضى ورجل مجتمع من الطراز الأول ورجل محترم واللي يلبس في لبس طبي وبدل محترمة وله العديد من السلوكيات الحسنة والأخلاق، وفي الليل يتحول إلى قاتل وزاني وفاسق وكاذب ومدمر ومجرم وهو المستر هايد. نتيجة أنه هو الدكتور هذا اكتشف عقار معين يخلي الشخص يتحول إلى شخصين، زي ما يقولوا ففي كل إنسان شخصيتين، شخصية صالحة وشخصية طالحة أو سيئة. إذن هذه القصة هذه استوحت السلوك المزدوج للماكروفاج. فجماعة الدكاترة متاعين الاميونولوجي يسموا في الماكروفاج the Dr. Jekyll and Mr. Hyde of the immune system. الدكاترة متاعين الاميونولوجي يسموا في الماكروفاج لأنها عندها pro-inflammatory response by producing inflammation mediated by interleukin 1, 12, and 23 and chemokines, and the other anti-inflammatory effect promoted by interleukin 10, TGF beta, transforming growth factor beta, producing anti-inflammatory effect, immune suppression, and fibrogenesis. فالسلوك هذا سبحان الله عكس بعضها بالكامل، اللي هو الريسبونس اللي احنا خدينا هنا، واحد اسمه M1 والاخر اسمه ايش؟ M2. فالريسبونس هذا زي ما نقولوا عكس بعضه، خلى الدكاتره متاعين الطب يستوحوا هذا السلوك من قصه الكاتب العظيم الاسكتلندي روبرت لوي ستيفنسون by his famous Gothic novella The Strange Case of Dr. Jekyll and Mr. Hyde. قصة الدكتور جيكل ومستر هايد. ننصحكم تمشوا اليوتيوب وتخشوا مثلوها في أكثر من فيلم، ولو حصلتوا PDF of the original story translated in Arabic, or maybe you can read it in English. It's called The Strange Case of Dr. Jekyll ومستر هايد. القصة أو الحالة الغريبة للدكتور جيكل والمستر هايد أو السيد هايد. تمام، نفس ما حكينا من قبل، قلنا the macrophage is usually termed as the Dr. Jekyll and Mr. Hyde of the immune system. It's the monocyte and the macrophage which has typically a phagocytic function يعني وظيفة بلعية. They ingest, kill and eliminate the microbial agent and also the dead tissue which is called a necrotic tissue. The activated monocytes secrete interleukin 1 and tumor necrosis factor alpha, which are the cytokines that make a chemotaxis, which is the recruitment of the polymorphonuclear leukocyte at the site of the injury. يعني وظيفة الماكروفاج بعد ما يصير لها activation إنها تنتج ال 2 cytokines interleukin 1 and TNF tumor necrosis factor, which are a potent chemokines or a chemotactic agent. The macrophage has both function، لها وظيفة مزدوجة، إنها pro-inflammatory by the production of interleukin 1, interleukin 12, 23 and tumor necrosis factors. This is the first response, which is called M1. The second phase, which is called M2, is which is mediated by the anti-inflammatory cytokines interleukin 10 and by production of interleukin 10 and TGF beta. Both of them promote inflammatory arrest and anti-inflammatory response with enhancement of immunosuppression and fibrogenesis. وهذا سبحان الله يعني سلوك مزدوج معاكس على السلوك الأول. السلوك الأول يسبب tissue injury و cytotoxicity and it's called pro-inflammatory response M1, while the M2 are the anti-inflammatory response. كيف يصير activation للماكروفاج؟ يصير في كروستوك همس خلوي ما بين الماكروفاج والليمفوسايت. كيف؟ الماكروفاج تطلق interleukin 12 and interleukin 23 which activate the T lymphocyte. والT lymphocyte activate the macrophage by IFN gamma اللي هو interferon gamma. That's why the activation of the lymphocyte by the pro-inflammatory cytokines interleukin 12 and interleukin 23. So interleukin 12 and 23 activate the lymphocyte to get activated into T helper 1 and T helper 17s and lead also to recruitment of the other inflammatory cells with subsequent release of the inflammatory mediators. This will recruit the polymorphonuclear leukocyte or the neutrophils producing inflammation. فالresponse هذا throughout interleukin 17 and tumor necrosis factor which make a lymphocyte able to activate both macrophage by IFN gamma, interferon gamma, and activate or recruit the polymorphonuclear leukocyte, the neutrophil, by the pro-inflammatory cytokines, tumor necrosis factor, and interleukin 17. And this response is called T helper 1 and T helper 17. فلو قلت لكم TH1 and TH17 تلاحظوا بأن ال H هذه capital ولكن تكتب بشكل صغير تحت السطر. تمام؟ This is the first mode of the macrophage activation, activating the lymphocyte. The other mode is that the activation of the macrophage will lead to also recruitment of the neutrophils by other cytokines called interleukin 1 and tumor necrosis factor alpha. فتلاحظوا بأن الفارق هذا إن هذه interleukin 17 وهنا interleukin 1. وهذا يؤدي إلى enhancement of other cells to produce an inflammatory mediators with subsequent leukocytic recruitment. فتلاحظوا بأن هنا سبحان الله الماكروفاج تدير activation التي ليمفوسايت. تلاحظوا بأن الماكروفاج also it's an antigen presenting cells، صح ولا لا؟ يعني ايش؟ تدير presentation للانتيجين للمان للخلية هذه. ايش اسمها الخلية هذه؟ تي هيلبر 1 اللي هي نايف تي ليمفوسايت او تي هيلبر سيلز. والاكتيفيشن اوف ذا ماكروفاج للتي ليمفوسايت is mediated ان الماكروفاج تطلق الانترلوكين 12 and 23. عكس ذلك الماكروفاج تبي تكون activated تتحول الاكتيفيتد ماكروفاج اللي هي M1 عبر السيتوكاينز اللي يطلقها من التي ليمفوسايت، يعني الايفن جاما. معناها التي ليمفوسايت تعتمد على الماكروفاج انها get activated into Th1 and Th17 by the pro-inflammatory cytokines 12 and 23 interleukins, while the macrophage تعتمد depends on the T helper cells by production of the cytokines IFN gamma. فكلاهما يحتاج إلى الآخر. الماكروفاج تدير activation للتي ليمفوسايت والتي ليمفوسايت تدير activation للماكروفاج، وفي النهاية it will lead to recruitment of inflammatory cells with subsequent inflammatory response. So the activated lymphocyte and macrophage stimulate each other. كل منهما يساعد الآخر أن يصير له activation. With subsequent release of inflammatory mediators, for example interleukin 17, tumor necrosis factor, interleukin 1 and IFN gamma. هنا درت اختصارات الايفين جاما، انترفيرون جاما، انترلوكين 1، ايل 1، تي ان اف tumor necrosis factor. تمام؟ So the interaction is that lymphocyte interact with the macrophage and secreting the cytokines and the chemokines. And the final comment is to recruit what؟ زي ما قلنا الوظيفة النهائية انه يصير recruitment. كلمة recruitment كلمة جميلة معناها جذب او حشد أو جذب. الماكروفاج is at the same time is considered to be APC, antigen presenting cells, which activate the T helper cells by the pro-inflammatory cytokines interleukin 12 and 23, while activated T helper 17 will release interleukin 17 and tumor necrosis factor to promote inflammatory response by the recruitment of the polymorphonuclear leukocyte. The activation of the T helper cells will lead to formation of gamma interferon, which subsequently activate the macrophage, while the activation of the B lymphocyte will lead to, by the antigen, lead to transformation of the B lymphocyte into the plasma cells, which produce the immunoglobulin IgG-E-A-M-E-D اللي هو الاميونوجلوبولين. احنا عارفين ان الميجر immunoglobulin in the primary infection is called IgM, while in the secondary infection is called IgG. What's about the second cells, which is called the fibroblast? If there is a fibrogenesis, إذا كان في تليف، فإن الفايبروبلاست تظهر في الوجود أو تظهر على قاع من القاع إلى الوجود. It produces extracellular matrix proteins and it usually promotes wound healing by the process of the fibrogenesis. What are the substances that produce by the fibroblast? The fibroblast produce interleukin 6, interleukin 8, the COX-2 enzyme, hyaluronan, which is the major constituent of the extracellular matrix, prostaglandin E2, which is as a constituent of the COX pathway, CD40, and extracellular proteins and multicellular proteins. Matricellular proteins, which are the proteins of the extracellular matrix. Let's see an example of a morphology of the chronic inflammation. هذا شاب عنده chronic eczema. You can see that the skin is inflamed with scaly. Scaly معناها فيه قشور. and it's chronic. There is a line of demarcation between the normal skin and the abnormal skin, so this is eczema. طبعا الليبيين بعد ما تقول له eczema لما يقولوا eczema. eczema يقول لك التهاب. طبعا الeczema is just nothing but a chronic inflammatory response to the cells. So you can see that the main cells here are either the main inflammatory cells here are the macrophage and the lymphocyte. So there are two types of the cells responsible for the chronic inflammation. وهنا مكبر لك الصورة هذه وداير لك أسهم على من؟ على الخلية هذه اللي نواتها طرفية و eccentric nucleus with granular cytoplasm and mononuclear cells, which is the macrophage. You can see that these cells are having eccentric معناها طرفية أو في الحافة with perinuclear clearing, and these cells are the macrophage. Actually, this is not a macrophage, this is a plasma cells. Okay, so the plasma cells are the cells which having eccentric nuclei. Actually, the macrophage also, like this one, is also having eccentric nucleus. لكن اللي بداير عليها المثال هنا ما هياش الماكروفاج على فكرة، هي البلازما سيلز اللي هي تنتج ايش؟ قلنا هنا تنتج الامينوجلوبولين، mainly immunoglobulin IgG و IgM. تمام؟ Let's take a case study and clinical pathological correlation with this يعني within this in this situation في هذه الحالة. So a case study and clinical pathological correlation. بثينة is a 33-year-old woman from حي الزقم في طبرق قريب من منارة. She complains of excessive menstrual bleeding and pelvic pain. بثينة عندها نزيف في الدورة الشهرية وعندها ألم في منطقة الحزام أو الحوض لمدة 4 أشهر متصلة. بثينة متزوجة وما تبيش تكون حامل، فاستخدمت اللولب اللي هو الجهاز اللي يوضع في الرحم، يسموه فيه intrauterine contraceptive device IUCD for the contraception. كانت مركبتها من 5 سنوات. بعد ما طلعتها وخذت endometrial biopsy, she found an excessive plasma cells and macrophage within the stroma. هذه العينة اللي خذوها لقوا فيه this is a macrophage and this is the plasma cells. تمام؟ وهي كانت مركبة اللولب اللي هو الداخلي intrauterine contraceptive device IUCD. For what do you think the presence of these cells and scattered lymphoid follicles within the endometrial stroma, does that make sense for you? Means that this stroma is evident of which of the following condition. يعني لو انت شاطر تقول بأن اللولب هذا اللي هو في رحم بثينة سبب لها مع الوقت لمدة 5 سنوات ايش؟ هو طبعا سبب لها عدم الخلفة، وهذه كويسة ان هي مستخدمتها عشان خاطر contraception لمنع الحمل. Was the condition endometrial abscess? Or was the condition chronic endometriitis? Yes. So number B is the answer. Acute endometriitis no. Endometrial fibrosis no. Endometrial carcinoma. ليش؟ لأن في cells are plasma cells and macrophage in the stroma. Plasma cells and the macrophage are the cells of chronic inflammation. So Buthena is having a typically chronic endometriitis. So let's highlight it here as chronic endometriitis. So now we will take something that we already took it in the general pathology. في جزء أصلا خذيناه في general pathology ألا وهو the granulomatous reaction and the formation of the granuloma. نحن قلنا الجرانيلوما is created by the response of tumor necrosis factor and interleukins and tumor necrosis factor and interferon gamma, and it's mainly having a lymphocyte, epithelioid cells. These are epithelioid cells اللي هي خلايا المفلطحة هذه, و multinucleated giant cells. So you can see the formation of the granuloma is mainly by the activated macrophage, multinucleated giant cells. In case of infection we term it Langhans giant cells. طبعا الجزء هذا نبي نمر عليه بسرعة لأن أصلا نحن خضيناه. والليمفوسايت زي هذني. إذا الصف الأول عبارة عن epithelioid cells زي هذه وزي هذه وزي هذه, خلايا مفلطحة من الماكروفاج. والثانية المالتينيوكليتد جاينت سيلز اللي هي لانغهانز. والثالثة ليمفوسايت زي هذه ليمفوسايت, هذه ليمفوسايت, هذه ليمفوسايت, هذه ليمفوسايت, هذه ليمفوسايت. والفايبروبلاست at the end, which is these cells, like for example these cells اللي هي الخلايا المغزلية اللي تكون extracellular matrix. The granuloma is nothing but a reaction to a persistent T cell response. For example, the TB. Another example for the granuloma, this is a caseating granuloma, and this is a multinucleated giant cells, and this is the epithelioid cells, lymphocyte, and macrophage. This is, for example, it might يعني أمثلة للgranulomatous reaction is the, or granulomatous inflammation is the foreign body, TB, or infection like TB, autoimmune disorders like Crohn's disease, and a certain autoimmune disorders like sarcoidosis. So foreign body infection like TB or leprosy. طبعا انتم عارفين التي بي اللي هو tuberculosis, syphilis اللي هو المرض الزهري, وليبروسي اللي هو الجذام, مرض الجذام leprosy. Autoimmune disorders like inflammatory bowel disease اللي هو التهاب القولون المزمن زي مرض كرونز و ulcerative colitis. Idiopathic condition like sarcoidosis. So this is the main granulomatous inflammation examples that we have been taking. So now let's take something related to the tissue repair, or we can move to another topic which is the tissue repair. The tissue repair is mainly the way how the human being deal with the regeneration. So the regeneration is mainly achieved by a certain cells called stem cell, خلايا جذعية. The stem cell عندها وظيفة مخصصة أو a characteristics which is peculiar. It's produce a self renewal and asymmetric replication. A self renewal تعوض فيها الخلايا الجذعية نفسها. والخلايا الأخرى اللي هي أول ما تبي تدير commitment تسبب asymmetric replication. The proliferation of the stem cell or any type of the cells is typically promoted by the so-called growth factors. But before the growth factors, let's see this figure, which maybe we can do it like this. So in general, the cells are in the normal population are in the steady state. في قاعدة في حالة ثابتة. يا أما يصير لها proliferation, for example hyperplasia or neoplasia, or the cells might differentiate, يصير لها commitment إلى differentiation status. The condition is mainly produced by these particular cells, which is called stem cell. The stem cell either make the cells in this condition اللي هي the quiescent or the senescent state, or it might get differentiated or proliferate to produce, for example, tumor. or they might commit suicide by programmed cell death apoptosis. So what is the function of these cells for the fate decision of the cells عشان تحدد مصير الخلية؟ either the stem cell either commit self renewal عشان تعوض نفسها اللي هو الانقسام التعويضي الذاتي, or it might proliferate or make commitment, or finally it might commit suicide by programmed cell death apoptosis. إذا السيلف renewal والproliferation والfinal differentiation اللي هو الcommitment و committing suicide by programmed cell death apoptosis are the fate cellular decision or cellular fate decision, cellular fate decision, يعني القرارات المصيرية اللي تتخذها أي خلية إما أن تعوض نفسها self renewal or proliferate or differentiate or commit commitment or commit suicide by programmed cell death apoptosis. So any stem cell having a two division, one is called symmetric division when the somatic cells produce two identical daughter cells, or the asymmetric division when the stem cell is able to produce two pathway. One is called self renewal, نتعوض نفسها, تلاحظ بأن الخلية هذه نفس اللون وتعطي differentiated progeny. فطبيعي جدا الانقسام هذا يسموه الانقسام الغير متوازي asymmetric. ليش asymmetric؟ لأن الخلية تعطي نوعين من الخلايا كانهن بالكامل مختلفات. أما في حالة somatic cell division is typically symmetric because each somatic cells will typically produce a two identical daughter. خلايا daughter معناها daughters معناها ابنة, خلايا الابنة. إذا this is the difference between the somatic cells and the stem cells. So the only cells which is able for the asymmetric division is the stem cell. So these are the stem cell major fate decisions, صناعة القرار الخلوي, which are self-renewal, proliferation, final commitment or differentiation, committing suicide by programmed cell death apoptosis. لو درسنا طبعا proliferative capacity of the tissue, we have to rely on the cell cycle. The cell cycle is divided into interphase and mitosis. The interphase is G1, the S phase or the DNA synthesis growth phase, or the growth and final preparation for division phase, which is called G2. The metaphase, mitosis is divided into 5 phases: prophase, metaphase, anaphase, telophase, and cytokinesis. So the cytokinesis is the final step before the separation of the two daughter cells. This is collectively termed as the cell cycle. Why? عشان نقسموا الخلايا في قدرتها على انقسام في جسم الإنسان قسموهن إلى تقريبا 3 أو 4 ثلاثة أنواع. خلايا لها القدرة الدائمة على الانقسام زي skin, oral cavity, hematopoietic cells in the bone marrow, columnar epithelium of the GIT, the columnar mucus-secreting cells in the endometrium, transitional epithelium of the urinary tract, and germinal cells in uterus and testis. Ovary and testis. These cells are called continuously dividing cells, and it can be termed as labile. Labile يعني الخلايا المتعارضة أو التي لها العرضة. Labile. While the second cell type, when it comes to the proliferative capacity القدرة التكاثرية, are the stable tissue, including liver, pancreas, and kidney. The one which cannot divide at all is the brain, heart, and we can add also RBCs. So what is the proliferation capacity? فمثلا هنا أعطاك مثال. Before coming to the growth factors, let's say this is a liver regeneration, يعني شخص معين. Maybe we can make it like this better. We can make it like this. First, the animation is like none. and then we can take just this one in the beginning, and after that we can take the examples of the growth factors in these circumstances. So لو شخص معين أزلنا له 3/4 الكبد أو ربع الكبد أو نصها زي ما تبي أنت. فمثلا الشخص هذا عنده كان كتلة في الكبد، شوفوا زلوا له جزء هذا كله وخلوا الجزء هذا خلال أقل من 6 إلى 8 أسابيع، شهر ونص أو شهرين، تم تعويض الكبد. الكبد هذه انقسمت عشان تعطي شبه الجزء اللي فقد هنا. So this is a liver resection after surgery leading to a total liver regeneration. وهذا يدل على أن الليفر كانها it's a proliferating tissue، رغم من أنه نحن قسمناها هنا الليفر أنها إيش؟ أنها هي slowly dividing or stable liver، ما هياش زي السكن والأول كافيتي والبون مارو هيماتوبيتيك سيلز والاندومتريوم وترانزيشنال ابيثيليوم والجيرمينال سيلز. So what is exactly the definition of the growth factors? The growth factors are proteins that are transiently produced in response to the external stimulus and usually work by signal transduction with outside-in signaling to promote the cellular division and proliferation, which is the mitosis, in a process of the DNA replication, and also promoting other physiological conditions including migration, angiogenesis, and neoplasia. Examples of the new growth factors are vascular endothelial growth factor (VGF), fibroblast growth factor (FGF), epidermal growth factor (EGF), platelet-derived growth factor (PDGF), transformed growth factor beta (TGF beta), tumor necrosis factor TNF، interleukin 1 interleukin 1 IL1. طبعا انتم عارفين ان في هيباتوسايتك جروث فاكتور ريسبتور، في كيراتينوسايت جروث فاكتور كيراتينوسايت جروث فاكتور، وعندنا هيباتوسايت جروث فاكتور، عندنا هيباتيك جروث فاكتور. في يعني هذني على سبيل الامثله للحصر. باهي. So this is exactly how the cell promote the process of اللي نحن حكينا عليه من الأول، the process of healing or repair. So the regeneration is mainly produced by a certain cells which is called the stem cells and mainly promoted by the growth factor. فيه ثورة قاموا بها العلماء، قام بها بداية العالم الياباني شاين ياماناكا سنة 2012 by simply the production or reprogramming of mature cells to produce stem cells. شندار ياماناكا سنة 2012 فاز بجائزة نوبل للطب عن هذه التجربة. شندار جاب فايبروبلاست سيلز، حطن في بتري ديش وحط عليهن the totipotency or pluripotency genes OC34 نانوج سيميك and SOX2، وخلت الخلايا اللي هي ستيبل هنا فايبروبلاست تتحول إلى stem cell like cells. الخلايا هذه سماهن ياماناكا induced pluripotent cells I small P capital S capital. These cells are having a stem cell like potential that can differentiate into any derivative of the cell layers. يعني ectoderm زي CNS، mesoderm زي ال RBC وال white blood cells or muscle or cartilage، endoderm زي الجلاد. على هذا الأساس أعطوه جائزة نوبل في 2012 for the commitment or the production of induced pluripotent cells by putting the pluripotency genes SOX2, CMYC, KLF4, NANOG, and KLF4, yeah, producing a stem cell from the differentiated cell. يعني ياماناكا في التجربة هذه إيش دار؟ خذيناها نحن من قبل بأن خلى الخلية ترد إلى الماضي متاعها وتتحول من خلية differentiated إلى خلية كانها undifferentiated, which is able to finally differentiate between to produce ectoderm, mesoderm or endoderm, the derivative of the inner cell mass in the embryogenesis. معناها بالشكل هذا يقدر الخلايا اللي هن هذني ملهنش قدرة على الانقسام زي الهارت والار بي سي cardiac myocyte and the CNS cells will be able to divide again. فهذه تعتبر خلقت ثورة بأن الخلايا the permanent cells can also be able to make the division. So this is a revolution which has been done by Yamanaka. So what is exactly tissue repair? Tissue repair can be can be achieved by regeneration, or it might reach to a total restoration of the tissue. والله أحيانا الريبير ما يجيش بأن يتكون التشيو من نفس النوع وتستبدل الجزء الذي صار له الانجري بسكار, which is scar means ندبة. إذا في tissue repair the tissue can be repaired by the process of regeneration, هو التعويض. والتعويض إما أن يكون بنفس الخلايا نوع الخلايا أو it can be replaced by a connective tissue mesenchyme, which is the fibroblast. The connective tissue deposition involved in a process physiologically called angiogenesis, migration, collagen synthesis, and remodeling of the connective tissue to form back the organ into the normal condition. Repair by the connective tissue will start by a formation of a peculiar tissue called granulation tissue, which might escalate later on if there is significant injury to form a fibrous tissue or scar. يعني عشان الأنسجة تصل إلى وضع الريبير اللي هو التصليح ضروري تكتسب قدرة على أن تتحول إلى النسيج الأصلي اللي هي قبل ما يصير لها injury or toxicity. إذا ما صارش الكلام هذا وعوضت نفس النسيج كان بها، هذا اسمه فيه البرايمري ريبير. إذا ما صار شكي معناها ضروري تعطي أنسجة ليفية عشان تعطي الندبة عشان تعوض على النسيج اللي صار له injury. So let's see, for example, here there is some molecular aspect of the pluripotent stem cell of the mesenchymal cells. So the mesenchymal cells differentiation here, for example, the pluripotent marrow-derived stromal cells will produce the endothelial cells under the effect of VGF, vascular endothelial growth factor, or FGF, fibroblast growth factors, or it might produce muscles under the effect of MyoD or myogenin cytokines, or under the response of SOX9 it can form the chondroblast. SOX9 is SRI box transcription factor 9, which is responsible for the sex determination in utero. Or under the effect of CBFA1 الخلايا متاعت the pluripotent stromal derived cells, it might produce the osteoblast by the effect of CBFA1, that is the core binding factor alpha 1, or by the response of the peroxisome proliferation activated receptor gamma factor, it can transform into the fat cell, which is the adipocyte. فتلاحظوا بأن ال FGF وال VGF يحولن ال pluripotent marrow derived stromal cells into the endothelial cells, while SOX9 يساعد على transformation of or differentiation of the pluripotent stromal cells or the mesenchymal cells to differentiate into the chondroblast via SOX9 transcription factor. And the transcription factor CBFA1 core binding factor alpha will help to differentiate transcription factor that help to differentiate osteoblast from the pluripotent stem cell, while PPAR gamma, that is the peroxisome proliferation activated receptor gamma, will help to form the fat cells from the pluripotent mesenchymal cell stem cell. And finally, the muscles will get formed from the pluripotent stromal cells by the effect of myogeny. So these factors اللي هو هذني VGF and FGF2 are a growth factor, while SOX9, CBFA1, PPAR gamma are transcription regulator, or we can call them transcription factor. تمام؟ So عشان يحدث injury، توقعوا مثلا افترض نفسك بانك انت اصبت او جرحت، حيتكون granulation tissue، صح؟ So what are the granulation tissue actually? The granulation tissue أول ما تنجرح بعد ثاني يوم يجد في منطقة حمراء وتنزل في المية كصفرة، هذه هي granulation tissue. These are a connective tissue which is rich in a tiny blood vessels form at the surface of the wound. أول ما يبدأ wound healing، شفاء الجروح، غالبا يتكون first step is the granulation tissue. You can see the blood vessels and edema in between the fibrovascular core with loose extracellular matrix with some inflammatory cells, and you can see the collagen is bluish. الكولاجين هذا بدأ يتكون عشان يغطي المساحة المفقودة. So the histology is fibroblast with tiny blood vessels. This is the blood vessels. هذا الجزء هذا والجزء هذا والجزء هذا، هذا كله blood vessels، والجزء السماوي هذا الكولاجين، والانفلاماتوري سيلز مين الماكروفاج زي هذه زي هذه زي هذه وزي هذه. الخلايا الدائرية اللي فيها eccentric nucleus are mainly macrophage. So these are called granulation tissue. المادة اللي في النص اللي حط فيها الفايبروبلاست، حطن فيها طبعا الفايبروبلاست زي الخلية هذه فايبروبلاست، وهذه فايبروبلاست خلية مغزلية، هذه فايبروبلاست، وبدأت تتكون ايش؟ الحزم هذان اللي هنا الكولاجين فايبر. So the fibroblast will lay down a substance called extracellular matrix. So let's see the extracellular matrix. What is the ECM? The main proteins for extracellular matrix are collagens from 1 من collagen 1 لعند collagen هذا كم؟ هذا رقم 17 صح؟ سوري هذا الثامن عشر، من 1 إلى 18 كولاجين، وفي إلاستين وفايبريلين وفي cell adhesion molecules which can be، تتذكرون خدناهم في الانفلاميشن، can be immunoglobulin or cadherin, for example E-cadherin which is a component of the extracellular matrix, and can be integrin and can be selectin. These are the extracellular matrix. The other extracellular matrix include proteoglycan and hyaluronic acid. الاكستراسيلولار ماتريكس هي اللي موجودة هنا، تلاحظ انها موجودة ما بين الخلايا وما بين البلاد فيزلز اللي يبدأ يتكون فيها الكولاجين by the fibroblast. So this is the extracellular matrix. Let's see قبل ما نبدأ الانجيوجينيسيس او قبل ما نبدأ الاكستراسيلولار ماتريكس نشوفوا صورة للجرانيوليشن تيشيو. هذه الجرانيوليشن تيشيو، شوفوا منظرها. This is a normal healthy granulation tissue. لونها هيكون أحمر والقاع متاعها لونه أصفر، وفي a lot of new blood vessels formation with start to build up the so-called new blood vessels formation and extracellular matrix. الهيستولوجي بتاعها حيكون new blood vessels، والخلايا mainly حتكون macrophage وفايبروبلاست. هذه فايبروبلاست، هذه فايبروبلاست، هذه macrophage، هذه macrophage. So these are the granulation tissue normal morphology. Granulation tissue normal morphology. But before we moved to the last topic of today's lecture is the angiogenesis. تمام؟ Angiogenesis. Angiogenesis is the formation of the new blood vessels formation from a cell which is called pericyte. So the tissue needs angiogenesis زي ما neoplasm needs angiogenesis, which mainly promoted by the growth factor which is driven from the tissue itself. It's called angiogenic factor. For example, FGF, PDGF, and VGF. Vascular endothelial growth factor, fibroblast growth factor, and platelet derived growth factor. The budding يتكون برعم من البداية. البادنج هذا يتكون من sprouting of the new blood vessels. This is sprouting اللي هو خروج أو بروز. The new blood vessels get sprouting from the main blood vessels by the proliferation of these external cells. It's called pericyte. Pericyte. So there is a growth of the new blood vessels which recruit another cells that is lie externally to produce the outer coverage of the new blood vessels اللي هو البرعم اللي خرج فيتكون new blood vessels. وتلاحظوا بأن main cells which line the blood vessel from inside is this cell اللي هي نحن سميناها endothelial cells. فتلاحظوا بأن اللي يصير فيه sprouting في البداية يصير فيه sprouting endothelial cells، بعدها يصير recruitment ال other type of cells which come externally here and it's called pericyte. By this way there will be a growth of the blood vessels and finally the endothelial cells will get covered by the serosa or the outer coverage. The pericyte will finalize the blood vessels externally and then the new blood vessels will get formed. This process is mainly controlled by an angiogenic factor اللي يخلي أصلا السبب بأن يصير في sprouting من blood vessels هذا angiogenic factor اسمه the factor which promote the new blood vessel formation. Mainly here for example the VGF vascular endothelial growth factor. لكن على سبيل المثال ايش اللي خلى البلد فيزلز هذا يبدا يصير له budding and sprouting which form a vessel sprout. It's the angiogenic factor. One of the major angiogenic factor is basic fibroblast growth factor BFGF and platelet derived growth factor PDGF. So what are the different steps in the tissue repair or the process of regeneration? تخيل نفسك مثلا مجروح بسكين، حيصير فيه tissue injury، صح ولا لا؟ how the process of regeneration occur either by a total replacement of the normal tissue or a process of scar formation. أما أن تكون المشكلة كبيرة أكثر ويؤدي ذلك إلى تكوين ندبة. So imagine me a normal epithelium and there is a blood vessels underneath with a local macrophage and the lymphocyte in the submucosa or the under the skin. If there is a mild superficial injury, there will be more recruitment of the lymphocyte, neutrophil, and macrophage with the new blood vessels formation. While here, if there is severe injury, there is a big loss of the epithelium. تلاحظوا هنا there will be more recruitment of the macrophage, neutrophil, and lymphocyte. Imagine the regeneration with the normal cells here will maintain that the tissue will come back to normal, while if there is a tissue epithelial loss with great degree of gapping, there will be a formation of scar اللي هو الندبة. So the steps of the regeneration is on first by blood vessel formation, angiogenesis, migration of the fibroblast to deposit more extracellular matrix and connective tissue at the area of the lesion, and finally by the scar formation. If the scar formation cannot be replaced, then the area will be replaced by the scar اللي هو الندبة. This process is called remodeling. So remodeling is maturation and reorganization of the fibrous tissue to form a stable scar عشان يكون ندبة يعني منظمة أو منمقة. كلمة remodeling معناها منظمة. So what are exactly some factors that influence the tissue repair? The presence of bacteria or under infection or any infection usually compromise the wound healing and producing more tissue injury. The vitamin C deficiency and other nutritional deficiency like selenium or zinc. The corticosteroids are anti-inflammatory, so that's why they delay wound healing. So if you're taking corticosteroid, this will typically lead to delay wound healing. هنا ناخذ صورة لشخص تقريبا صار له حريق في يده وأدى إلى excessive scar formation, the so-called scar. هنا الابيثيليوم. Under the epithelium there is a keloid. So what is keloid actually? This is called keloid. So تعريف الكيلويد is an excessive collagen deposition of the skin and it usually raise up the skin. يعني skin يقعد مرتفع، فنحن نسمو فيها الندبة البارزة. ناخذ مثال آخر هنا أعتقد ممكن توضح الموضوع أحسن. This is a keloid which is an excessive scar formation. هذه بنت عملت piercing، يعني داروا لها ثقب في الأذن بتاعها عشان الجلي، نحن الليبيين نقولوا جليلة أو الرينجز earrings اللي هن حلقات الأذن. There is an excessive production of the fibrous tissue under the piercing side, so leading to the formation of the so-called keloid. And this is a sequelae of ear piercing اللي هي ثقب أو تفراية نحن نقولوا بتاعت الأذن عشان خاطر الجليلات. Mainly the fibrogenesis is maintained by the TGF-beta, which is a potent angiogenic factor leading to more deposition of the extracellular matrix and deposition of the fibrous tissue. There should be a dependence or a balance between two factors. Factor يساعد على الانجيوجينيسيس، الفايبروجينيسيس، factor يساعد على الفايبروجينيسيس وفاكتور يمنع الفايبروجينيسيس. For example, matrix metalloproteinase MMPs usually they digest the ECM فيمنع تكوين الكيلويد، while the TIMPS, the tissue inhibitor of the metalloproteinase, they oppose the action of the matrix metalloproteinase وبالتالي يساعد على الكيلويد formation. قبل ما نجول لهذه تقريبا اعتقد نقدر نوريكم لحظة شوية بس ندير انيميشن. هذه بنوريكم الجناح متاع الانجيوجينيسيس في الاكتيفيشن of the macrophage by the alternative macrophage activation M2 أهو. تتذكروا هنا. So the alternative activation of the macrophage by anti-inflammatory cytokines interleukin 10 and TGF-beta will produce anti-inflammatory effect, and finally the SCOM TGF-beta, which is the transforming growth factor beta, which mainly promote fibrogenesis, eliciting the tissue repair and fibrosis. So the main responsible pathway for the fibrogenesis is the alternative pathway, which is M2, promoted mainly by interleukin 4-13 and inhibited by IFN gamma اللي هو interferon gamma. اعتقد انه يجي بعدها الباثواي هذا اللي هو تتذكروا هنا interleukin 4, 13, 10 and TGF-beta are the one which is responsible for the M2 alternative activation, which promote the angiogenesis, and this will eventually produce the factors that make tissue repair and promoting fibrogenesis, like for example angiogenic factor, platelet-derived growth factor, VGF, EGF and arginase. And the anti-inflammatory cytokines are interleukin 4, 10 and tumor necrosis factor, transforming growth factor beta TGF-beta. تمام؟ اعتقد توا عرفتوا بأن alternative macrophage activation is the one responsible for the fibrogenesis. المحاضرة اليوم فيها كثير من المولكيولر ولكنها بسيطة، يعني ليست معقدة بما فيها الكفاية، عبارة عن بس تفهم الانجيوجينيسيس والفايبروجينيسيس. وخلينا قلنا the role of TGF beta here is to promote the angiogenesis, to promote the fibrogenesis by enhancing the fibrogenesis by inhibiting the effect of the matrix metalloproteinase, which is the one responsible for the digestion of the collagens and the extracellular matrix, and promoting the tissue inhibitor of the metallic metalloproteinases, TIMPS. The TIMPS usually oppose the action of the matrix metalloproteinase and mainly produce keloid اللي هي excessive scar formation, like for example this girl that make ear piercing, that is excessive fibrogenesis. فتلاحظوا بأن excessive fibrogenesis محصلة من inhibition of the matrix metalloproteinase and induction of the TIMPS اللي هو tissue metalloproteinase inhibitor or tissue inhibitor of metallic proteinase. Opposite scenario here can be seen by إن ما يتكونش أي healing وتكون scar، زي هنا مريض diabetic عنده chronic skin scar due to that the fact there is an edge friction here with pressure at the site of the skin. This patient is diabetic with a typical pressure sore or ulcer. This is an opposite scenario of a lack of healing. ما فيش أي healing ولا في أي fibrogenesis. So this is an opposite scenario. But because before that, can we take the factors which is leading to retardation of the wound healing؟ يعني ما هي العوامل التي تؤخر شفاء الجروح؟ فيه local factors، عوامل موضوعية في الجرح نفسه، زي reduction in the blood supply, reduction in the nerve supply, denervation, local infection, presence of foreign body or hematoma at the site of the wound, or mechanical stress زي الحركة في مكان الجرح، أو presence of any necrotic tissue. foreign body زي ما يجد فيه تراب أو طلقة بوليت يعني طلقة رصاصة، أو يكون في أي خشب أو حديد في منطقة الجرح يؤخر من التئام الجرح. These are the local factors. While the systemic factors are reduction in the blood supply, age، كل ما كان الشخص كبير في السن كل ما الهيلينج أقل. presence of anemia كذلك يؤخر شفاء الجروح. presence of malignancy الأورام يؤخر شفاء الجروح. سوء التغذية malnutrition, obesity السمنة. infection الإصابة أو البكتيريا. and multi-organ failure also delay or retard wound healing. فلو قلت لكم enumerate the local factors for the wound healing تقول لي reduction in the blood supply, denervation, local infection, foreign body, hematoma, mechanical stress, and necrotic tissue. Systemic factors that lead to delay wound healing are reduction in the blood supply or decreased blood supply, age, anemia, malignancy, malnutrition, obesity, infection, and organ failure. So let's see now two patterns of wound healing اللي خذيناهن من بدري. تذكروا خذيناهن هنا كيف تشفى الجروح بهذا الشكل. قلنا يا اما يكون في simple gap between the epithelium leading to mild and superficial injury, or there is a severe injury with a great big area of tissue and epithelial loss. This will lead to a total regeneration, which is the primary healing, or the scar formation, that is the secondary intention or the secondary healing. Now we will take the details of this reaction. So let's say this is the skin with the formation of the clot of a fibrin block at the edges of the skin. The fibrin block will continue and there is a regrowth of the basal layer of the skin. leading to formation of or total continuation of the epidermis. And then الجزء هذا اللي هو الكلوت هذا الفايبرين there will be lysed. يعني there will be a lysis of the fibrin and a total epithelialization. Re-epithelialization يعني تعود الابيثيليا من جديد وتذوب اللايسس هنا خلال ايش؟ weeks. So this is throughout days and this is throughout weeks. Here there is a total restoration of the intact skin. This is called healing by primary intention. وهذا يحدث أول ما يكون الليجن اللي ساير كان minimal ولا severe injury أول ما يقعد فيه mild to moderate injury leading to ايش؟ restoration of the intact skin within weeks. This is called healing by primary intention. While if there is a big area of epithelial loss here, there will be also a fibrin clot formation with granulation tissue formation in the area between dermal and epidermal junction, and then here there will be a scar formation with the reduction in the amount of the fibrin, and also the epithelium will come back to normal with the formation of the scar. So here there is a large defect of the between the epithelium. That means there is a epithelial loss. So the fibrin clot will get formed. fibrin اللي لونها هنا تقريبا وردي أو أحمر. هنا new blood vessel formation will form the granulation tissue with the fibroblast and the mononuclear cells. There will be granulation tissue from the epidermis and dermis. Here the collagen will get laid by the fibroblast, and the fibroblast will restore the integrity of this area with subsequent scar formation. And finally, there is a maturation of the collagen, and the process is called remodeling to achieve the structure and integrity of that particular organ, and there will be a back total replacement of the epidermis back or regrowth of the epidermis. تلاحظوا بأن this is a large defect of the tissue injury. That's why the intention of the healing will be secondary. That's why we call it healing by secondary intention. فهذا يفرق two way of the healing. The first panel or module here is the healing by the primary intention, while the second is healing by the secondary intention. Last lecture for today there will be the healing of the skin. وقلنا ان عارفين طبعا السكين اكثر واحد يتضرر باعتبار انه هو العضو السطحي للجلد للإنسان. So the healing by the first intention occur if there is a small or mild injury. Healing by the secondary intention usually occur if there is a large defect of the area has been lost, or in case if there is an infection, presence of diabetes mellitus, and in case of steroid therapy which delay the whole wound healing. تلاحظوا بأن steroid يسبب inhibition of the collagen synthesis. That's why they delay wound healing. Healing by the secondary intention usually form a scar, يكون a scar, while the healing by the first intention usually the skin will go back to normal without any scar formation, and usually the lesion is mild injury. Excessive production of the extracellular matrix يؤدي إلى formation of the so-called keloid اللي نحن أخذناها من قبل. هنا الكيلويد اللي تحدث في حالة ear piercing أو إذا كان في large area of skin loss زي الرجل هذا اللي منكب عليهم مية ساخنة فصار له excessive fibrous tissue formation which is called keloid. تلاحظوا بأن السب epidermal fibrous tissue هنا are excessive والإبيديرمس هنا كانها thin. This is a formation of excess of collagen which is extracellular matrix proteins leading to the formation of a raised scar زي الشخص هذا الموجود، أو البنت هذه اللي قليلة حظ غالبا صار لها fibrous tissue formation or keloid in the area of the ear. This is called a keloid. عموما عشان نكونوا واضحين الكيلويد is commonly associated with healing by the secondary intention، وكذلك في الناس اللي هم لونهم اسمر شويه زي اللي نحن نقول عليهم السود او العبيد اللي هم سمر، غالبا يحدث عندهم excessive scar formation which is typically described as keloid. اعتقد ان اليوم بالشكل هذا اكملنا الجزء اللي متخصص بالchronic inflammation including anti-inflammatory response of the macrophage activation M2 and the angiogenesis promoted by interleukin 10 and transferrin growth factor beta. وخذينا tissue repair including the granulation tissue formation, extracellular matrix laydown, angiogenesis, and the two mode of the tissue repair by regeneration, either by first intention, which is called the primary intention, or the secondary intention, which is the healing by the secondary mode. ان شاء الله تكونوا استوعبتوا هذا الجزء من المحاضرة اللي يعتبر التتمة الأخيرة لجزئية الالتهاب، وبهذا الشكل تقريبا نكونوا قد أكملنا جزء الجنرال باثولوجي بالكامل. طبعا نحن الجنرال باثولوجي في جزئية الاميون باثولوجي نعطي فيه أحيانا مع الهيماتوبايوتيك، فنحن functionally we almost covered now finished the general pathology. إلى أن نلتقي في المرة القادمة، لكم مني أطيب التحيات، والسلام عليكم ورحمة الله تعالى وبركاته.